Cognitive behavioral therapy, CBT, is based on the theory that some human behavior is based on internal or mental events resulting in abnormal behavior. CBT works with our thoughts, our feelings, and our behaviors. What we think affects how we act and feel. What we do affects how we think and feel. And what we feel affects what we think and do. CBT therapists understand that by changing the way we think and acting in the here and now, we can affect the way we feel. CBT can also be applied longitudinally to explore the origin of beliefs, rules, and assumptions which shape an individual's worldview. This knowledge that can be used to drive change in the present. There are evidence-based CBT models and associated treatment protocols for a wide range of disorders. But CBT can also be used to formulate or conceptualize cases individually. One of the first therapists to address cognition in psychotherapy was Albert Adler, who lived from 1870 to 1937. It was with his notion of basic mistakes and how they contributed to the creation of unhealthy or useless behavior and life goals that this psychotherapy was developed. Adler's work influenced the work of Albert Ellis, who was born in 1917 and died in 2007, who developed one of the earliest cognitive-based psychotherapies known today as Rational Emotive Behavioral Therapy, or REBT. Around the same time that rational emotive therapy was being used and was being developed, Aaron T. Beck, who was born in 1921 and is still alive as a professor emeritus, was conducting free association sessions in his psychoanalytic practice. During these sessions, Beck noticed that thoughts were not as unconscious as Sigmund Freud had previously theorized, and that certain types of thinking may be the culprits of emotional distress. It was from this hypothesis that Beck developed cognitive therapy and called these thoughts automatic thoughts. It was these two therapies, rational emotive therapy and cognitive therapy, that started the second wave of CBT, which was the emphasis on cognitive factors and was known as classic cognitive behavioral therapy. Albert Bandura added the concept of self-efficiency around 1978, and that emphasized the social modeling or practice to the cognitive behavioral approach in therapy. Thus, the cognitive behavioral therapy would consist of, number one, presentation of the therapeutic rationale. Number two, the development of the awareness of the dysfunctional thought of the client. Number three, the substitution of normal or more functional thoughts. And finally, adding the behavioral part of it, the behavior modifications to model these changes from thoughts into actions. CBT is useful in treatment of such problems as depression, stress, anxiety, and academic underachievement, just to name a few. Now, critiquing CBT, cognitive behavioral therapy, as a Christian must begin in the behavioristic presuppositions of materialism, naturalism, animism, reductionism, and scientificism. As Christians, we must reject this part of CBT practices because they exclude God. They exclude God working in the life of a believer. And if we seek to follow them too closely in our acceptance, we will reject the power of God and His Holy Spirit in the working of a life wanting to change. Therefore, the desire to change and the power of God can be the focus. We must not focus too much on the psychological and forget the spiritual and biblical emphasis. When the biblical Christian counseling theory focuses on the cognitive and behavioral action orientation, it can mirror the CBT. That's important to remember, because this is why nouthetic and integrative therapies resemble CBT as much as they do, because they reflect the biblical and personal approaches while emphasizing the empirical accountability and the commitment to honesty. Thus, with a clear understanding and a biblical evaluation, the Christian counselor can learn and practice cognitive behavioral therapy with integrity.